Hello everyone, myself Dr. Utkal MP, Professor in the Department of Oral Medicine and Radiology. Today going to deal with a topic named red and white lesions. Red and white lesions, the content of this topic is not something which you all don't know. Since you have passed your third year and come down to the part 1, you would be doing the chapters which would have dealt in your oral pathology under the heading of pre-malignant lesions and conditions. Similar lesions or pretty much same lesions do come under this chapter also. As far as exams are concerned, red and white lesions are one of the most important topics in part 1, oral medicine, because this is one such topic wherein every alternate years we get a main question. If your long essay is for 10 marks or 14 marks, whichever pattern it is, very often we get to see questions on this particular topic. So that makes it very, heavy weightage topic under oral medicine subject. Together with a long essay, at times there are some short answers for 3 marks or 5 marks also, which have been asked regarding this particular topic. So keep a kind attention to listen to this particular chapter and try to score maximum when the questions comes on this. Together with in your practical exams, when you get to see the lesions in your clinics, you'll be able to diagnose well with a good knowledge about the red and white lesions. With this, let us start with the chapter red and white lesions, in which I'm first going to talk about the normal mucosa. Let us not go into the redness or the whiteness of the lesion. Let us talk about what is the normal color of the oral mucosa. As we all know, oral mucosa looks pink in color. We all would have observed it. Why does it look pink? That's the primary question. Now, the character of oral mucosa is a transclusent. That is, it's not completely stopping the light from reflecting, neither it is completely avoiding it. So, it is a substance which partially allows the light to travel through it. So, the light which penetrates covering the epithelium to various layers underlying tissues, that is your lamina propria or submucosal connective tissue, which includes connective tissue fibers and your vascularity. Vascularity as in nothing but blood vessels or red colored blood. So, the light which goes into the second layer of your mucosa or the submucosa, what happens to that? It either can get absorbed, it can get scattered, or it can get reflected. One of these three things will happen to it. And the final outcome or the picture what you get in your eyes of the oral mucosa is nothing but a pale pink color or a normal pink color, which is nothing but the reflection of the light which scattered or which strike the capillaries underlying the epithelium. If it sounds little complicated, to make it simple, if I can give an example of a red color bulb right in front of you, kept right in front of you, which would be bright enough and it would be looking red in color to you. Now, here the bulb is there which is red in color, which is glowing. Here you are there in the middle of your eyes and the red colored bulb. If I start placing multiple layers of translucent white color paper, it's not a transparent paper, it's a translucent paper. As and when I go on increasing the number of papers, what would be the amount of light reaching your eyes? It would be surely not as bright as it was before without any layers of paper. As and when the thickness or the number of paper increases, the brightness of the light reduces. So it's very simple. The red color light which it used to look red for you, now when I place multiple layer of translucent papers, becomes pink, because the lighter version of the red is nothing but your pink color. So that's the case of normal mucosa. Now let us go into the topic. Now why white in color? Because the pathological lesions which we are going to deal under this chapter are something which are looking white in color. What are the possible reasons because of which a pink colored mucosa ends up being white in color? Again, there are multiple reasons which I am going to explain to you. First is hyperkeratinization. Hyperkeratinization, let me split the term, hyper, increased, keratinization. Simple. Keratin layer is the layer of your epithelium, on the topmost layer of your epithelium. If there is an increase in this keratin layer, it starts becoming whitish. The simple funda, red bulb was there, the layers added are keratin layers. So automatically your eyes starts looking at a white color. It's not even pink. Because of few layers of the paper, it used to look the pink colored bulb. Now that you have increased the number of paper layers, it has become whitish. Same way here, under normal epithelial thickness, it looks pink. When the increase in the layer or increase in the keratin layer of the epithelium happens, it starts looking whitish. That is hyperkeratinization. Next possible reason because of which your pink mucosa can look whitish is acanthosis. Acanthosis is increase in the layer of prickle cell, which can happen because of the hyperplasia. If you remember the term, it's again not a new term to you all. In oral pathology, you would have learned the term hyperplasia and hypertrophy. Hyperplasia is increase in the number of cells and hypertrophy is increase in the size of the cells. Here we are talking about increase in the number of cells in the underlying layers of epithelium, which would cause overall thickening and in turn lead to whitening of the mucosa. So acanthosis will also lead to the pink colored mucosa to be seen as white colored. Next, fluid accumulation. Fluid accumulation, which could be intracellular fluid accumulation or even extracellular fluid accumulation due to various reasons, which can be inflammatory fluid accumulation or for other reasons, but ultimately would make your pink colored mucosa more whitish, because again the fluid accumulation is leading to the enlarge or increase in the layer of thickness of the epithelium, in turn leading it to make it look more whitish. Necrosis. Unlike the first three reasons, in first three reasons, one common factor is there is an increase in the layer. See, let me go back to the example what I gave. We spoke about a red bulb, which with the addition of the layer of papers became whitish or pink, then in turn white. The first three reasons which I gave for the appearance of oral mucosa to be white in color were all related to increase in the thickness for various reasons. Now, necrosis is something which is not related to increase in the thickness, rather it is related to coagulation of the surface tissue. When necrosis happens, let it be because of thermal necrosis, chemical necrosis, or for any reason tissue gets necrosed, it gets coagulated and surface will get filled with slough, or coagulated structures will be there, which will make it look whitish. So that is one more possible reason because of which your pink colored mucosa can look whitish. Lastly, we have pseudomembrane. An additional layer which is not supposed to be a part of your mucosa is developed over it, probably as a result of an infection or a necrosis also. Post-necrosis pseudomembrane formation also is possible because after a burn, there can be a formation of pseudomembrane. So in pseudomembrane, what happens? A white colored membrane is covering your pink colored mucosa. So when I look at it, it will start looking whitish. So these are the possible 5 reasons because of which a pink colored mucosa can turn into white. It's very important to understand the basics here. See, I could have started this chapter with the lesions. I could have started chapter with the explanation of each lesion and their clinical features. But what I'm trying to tell you is, let us first understand the basics at the level where we want to know why a normal mucosa can turn into white or why a normal mucosa will turn into red. Then, under each disease or the pathological conditions which we are going to deal with, we can put them under these headings. In the sense, whenever I see a white lesion, I can either think of one of these 5 reasons because of which it started looking whitish. So these 5 reasons are very important for you to keep in mind. If not, like, you're not going to write this in your exam for sure. This is not exam perspective. This is pure, understanding level. It is basically for you to understand why something can look white when it is actually pink in color. So keep this in mind only to correlate with the lesion and surely not going to be directly used in your exams or answers. Now let us understand why the lesion or why the mucosa, which is supposed to be pink in color, starts appearing red. 2 possible reasons. Atropic epithelium. Again, atrophy is reduction in the thickness. So imagine I have added a red color bulb. I have added 10 papers layers. So the light which reached you started looking pink. When I made it 20 layers of paper, it started looking white. Now I start removing this 20 papers. So it will again look red. What if I increase the brightness of the bulb? Then also it will look more red. So there are 2 possibilities. One is increased vascularization or decreased thickness. So if I reduce the number of sheets, it will look red. Or if I increase the brightness of the bulb, then also it will look red. Same way in oral mucosa, if the underlying connective tissue of the epithelium has increased vascularity for some or the other reason, let it be inflammation. There is inflammation because of which there will be increased vascularity of the underlying connective tissue of the epithelium, because of which the whole area gets more blood supply, in turn more red color. So the lesion, the mucosa can start looking reddish. Same way, atropic epithelium. The underlying blood supply is same. There's no change in the increase. There's no change or increase in the vascularity. but still there is a decrease in the thickness of your epithelium. How? There is an abrasion which has happened, which has reduced the thickness of your epithelium. So I'm directly seeing the underlying tissues now, or at least the epithelial thickness, which was supposed to be like 10 layered, is now 5 layered. So obviously the underlying redness will be more evident as compared to before. So these are the two possible reasons with which your normal pink mucosa can turn into red.